Hello, everybody. Reed here. Today, we're going to have an interesting conversation on Risperdal Consta. Risperdal has a long-acting injection. It's called Risperdal Consta. Risperdal is an atypical antipsychotic. Remember, there's a difference between a huge difference between the typical antipsychotics and the atypicals. The typical ones primarily bind the D2 receptor. And these typical antipsychotics block the D2 receptors to prevent the dopamine molecule from attaching to the receptor and activating the network. The problem with schizophrenia is basically the positive symptoms are a result of increased activity in that mesocortical pathway. It's overactivity. Remember, when that presynaptic neuron releases dopamine from that presynaptic cell, it travels across the cleft and it starts binding all those receptors. So if a person is taking cocaine, it causes to release a surge of release. And it goes across the cleft, binds all these receptors, and then it starts creating positive symptoms, right? We can block those receptors with Risperdal. So the atypical receptors, the typical antipsychotics bind the T2 receptors, but the atypical antipsychotics bind a range of receptors. And because they bind that range of receptors, then we can use those for mood disorders. So remember, the typical antipsychotics bind D2 primarily, and it blocks those receptors to help reduce the activity in that mesocortical pathway, that mesolimbic pathway. And when you start blocking the receptors in the extrapyramidal symptoms, you get things like, you get EPS, and you think it's like dystonias, you get all sorts of type of movement disorders once you start blocking those dopamine receptors in the areas that regulate mood, right? So here, Risperdal is a very effective atypical antipsychotic used for schizophrenia, also for bipolar disorder too, right? And I went through a lecture matrix. Let me see if I can find something. I went through the typical versus atypical antipsychotics. I need to label this thing better. Let me see. Typical versus atypical antipsychotics. Okay, limbic system. Anyway, I go over Risperdal and all the other atypical antipsychotics when you see the here, antipsychotics explain typical versus atypical, explained here. And I go through the mesocortical pathway here. Where is it? Mesocortical pathway here. And we talk about the differences between the typical and atypical antipsychotics. So I don't think I need to go over Risperdal as a molecule itself to explain Risperdal Consta. And so this discussion is about the Risperdal Consta and we want to use it as a long-term injection. Okay, so let me see here. All right, let me clear this. Explain the atypical antipsychotic Risperdal. Explain the atypical Risperdal Consta. I'll explain an atypical antipsychotic constant. What is this? Explain. So I can't read and write at the same time. Explain the atypical antipsychotic Risperdal. Okay. Risperdal Consta. Consta, Consta. Okay, focusing on the mechanism of delivery for this long-acting injection. Okay, let me see. I really want to go through how this Consta works, right? Risperdal Consta is a long-acting injectable atypical antipsychotic used to treat schizophrenia and bipolar disorders, right? It uniquely delivers, its unique delivery mechanism provides sustained release of risperidone over several weeks. And we want to look at this unique delivery mechanism. Very interesting there. This stuff is very interesting. Ensuring constant therapeutic levels with less frequent dosing compared to oral formulations. So, mechanism of delivery. Risperdal Consta is administered as an intramuscular injection every 2 weeks. The drug is encapsulated in microspheres made up of biodegradable polymers, right? Poly something, which enables its controlled release properties. And here's how it works. Remember, look at the lecture here on the Haldol decanoate injection right here. And I go through how the strategy there is to connect the Haldol and also the Thorazine, Haldol and the Prolixion medications are attached to an ester bond. And because it's attached to an ester bond, now it becomes lipophilic. So when you inject it into the deep muscle tissue, it dissolves into the fatty compartments. And then it's gradually hydrolyzed. And as it's hydrolyzed, the Haldol and the Prolixin is released, and now it becomes dissolved, lipophilic, not lipophilic, but dissolves in water. I forgot the terms. And then once it now becomes the active particle, so that was creating the ester bond for Haldol and for Haldol and the other, I can forget this. That's the strategy for Haldol and Prolixin. But here it's a different strategy. Look at this. Here, this microsphere technology. Risperdal is embedded within tiny microspheres of the PLG polymer, a biocompatible and biodegradable materially commonly used in medical implants and drug delivery system. After intramuscular injection, typically in the gluteal muscles, the microspheres form a depot in the muscle tissue, right? The gradual release. The PLG polymer degrades slowly via hydrolysis when exposed to the body's aqueous environment, right? This process breaks down the microspheres over time, gradually releasing the Risperdal into the bloodstream. So I think this polymer lipophilic, and then when they detach the molecule from the polycle, then it becomes it's allowed to enter the aqueous environment, the water, the body's water here. I keep forgetting that term, not lipophilic, but I keep forgetting the dissolving in water. Okay, the release of the profile is biphasic. Okay, the initial phase. There is a minimum drug release at the first few days post-injection, which is why oral Risperdal and another antipsychotic is often used initially to maintain therapeutic levels. So remember, if the Risperdal has that full profile of targeting a lot of those other receptors, and so you can use it for mood disorders and things like that. Now, if the patient isn't responding to Risperdal, then I can give a Risperdal injection and then maybe put them on a typical antipsychotic, right? Remember, the typical antipsychotics bind that D2 receptors, and they're very potent for blocking the mesocortical pathway and the mesocinematic pathway, and they're so potent you likely get side effects because it also blocks the dopamine pathways in the basal ganglia, right? So you get movement problems because it's so potent. Okay, now if a patient is on Risperdal, which targets a lot of the receptors and not responding, then I would probably put them on a Risperdal Consta shot and then put them on oral Haldol to start targeting that D2 receptor more, to start blocking more of that mesocortical pathway and the mesolimbic pathway to start managing the psychosis. So the long-acting medications are also very effective in using the 2 antipsychotic medication strategy. Now, one antipsychotic alone is associated with could be associated a higher incidence of side effects. And then the long-term implications of long-term use of medications is tardive dyskinesia, which is primarily a permanent movement disorder that comes along with chronic use of antipsychotics. But it takes decades to get to that point for tardive dyskinesia. But here, anytime you put patients on 2 antipsychotics, I'm very concerned. You have to document that the benefits outweighs the risk. The whole benefits outweighs the risk in this situation, And then you want to do things like the AIMS test, the autonomic involuntary movement scale, AIMS test, to see to track the potential side effects associated with long-term use of these antipsychotics. And so if you put patients on 2 antipsychotics, you want to make sure you follow up and document that they're not having side effects, because it increases the likelihood of having side effects and increases the likelihood of the patient developing tardive dyskinesia in the long run. So you want to make sure that you be responsible when you're using dual antipsychotics. Okay, this initial phase here, the sustained phase, starting around 2 to 3 weeks, the microspheres begin to release Risperdal steadily, reaching peak plasma concentrations around 4 to 6 weeks. This provides constant drug levels for approximately 4 to 6 weeks per dose. Now remember, this is the typical antipsychotics, like we went with Haldol and Prolix, and those are the D2 receptors if we want to get tonic inhibition of the D2 receptors. But then if we want to get tonic inhibition of all those other receptors that Risperdal have, we can just give the Consta for that, and we'll start blocking all the other receptors too. So there's a hand strategy when you think about which long-acting medications you're going to use, whether they're going to use typical or atypical. You have to think about those receptor profiles and really what your goal is here. But you can see targeting all those receptors blocking all those receptors probably a really good thing, very helpful in reducing the symptoms. Okay, next, the pharmacokinetics. Okay, after injection, Risperdal is metabolized into its active metabolite, 9-hydroxyrisperdal, which contributes significantly to its therapeutic effect. So Risperdal is metabolized into its active metabolites, and that active metabolites is what works. Steady state plasma concentrations are typically achieved at about 4 to 6 injections within 4 to 12 weeks when administered every 2 weeks. The drug is detectable in the body up to 6 to 8 weeks after the last injection due to the slow degrades of the microspheres. Administration, Risperdal Consta is supplied as a powder that must be reconstituted with a provided diluent before injection. It requires refrigeration and specific handling to maintain stability. The injection is given by a healthcare professional ensuring proper technique. Okay, advantage of long-term, of course, improved adherence, right? Stable plasma levels. Yeah, the stable constantly blocking those networks and keeping them blocked is a good thing. Reduce relapse risk. Consistent blood drug levels help prevent prevention. Yep. Let's see. Clinical consideration. Yeah, delayed onset. Due to the initial lag in drug release, patient may need oral supplementation during the first 2 to 3 weeks of treatment. Side effects similar to Risperdal Consta may cause EPS symptoms, weight gain, hyperprolactinemia, and injection site reactions. The dose is 12.5 milligrams, 25, 37.5, and 50. I think that's all I have for now. Let me see. Yeah, I think that's clear cut. If you need to learn more about Risperdal Consta, just check on Grok. Take care, everybody. I think that's it for now. Oh, I do have a question here. Let me see here. What's the most common side effect that you've seen and experienced as medication? See, I never, first you give the oral medications first. Okay. And I never give them the monthly shot if they're having side effects to it. But when they do take the medications, the most common complaint I get is the tenderness and soreness at the injection site. So so I don't really get much complaints besides that. Very rarely do I get patients who actually have side effects because they've been on the oral doses. Of course, you don't want to give a shot for 2 weeks. And when you haven't tested the patient on medication, right? And then also, you have to get consent to these long-acting medications because you can't deliver a medication that's going to impact the patient, have the patient in treatment for the whole month, right? You one dose and now the patient is impacted by your treatment for the whole month. And so you can only give long-acting medications with the full written consent for the patient. And if you don't have the consent, you can't give it. Many times you may have family members or people who want the patient to take long-acting medications and the patient refuses. The patient always have the right to refuse a long-acting medication because if you give it to them against their will, it is considered a restraint, right? It's considered more of a restraint, more of a chemical restraint, right? So you want to make sure that the patient understand how these things work before you give them a long-acting antidepressant, antipsychotic. And I think that's all I have for today, guys. Stay tuned. I think we have the Risperdal Consta. We have Risperdal. I think I'm going to do Invega next. I'll go through all the constant injections and things like that so you can have something to just briefly review. Okay, Reed, take care, guys. I'll talk to you later. Ciao.